You're watching The Source on CNN Philippines. I'm Pinky Webb. Our source today, health reform advocate Dr. Tony Leachon. Dr. Leachon, good to see you again. Welcome back to The Source. So let me start already, Doc Tony. Ano ho ba alam natin tungkol dito sa Omicron XE?
Well, ang Omicron XE is a new subvariant po ng Omicron. It's a recombinant type of strain ng BA.1 at saka BA.2. Ito yung unang nakita January 19 sa UK because of their, of course, rigorous genomic surveillance at 600 cases na. Napabalita na meron total sa Thailand nung isang araw at isang case pa. So the World Health Organization is coordinating with the Department of Health. But what we know from WHO is 10% more transmissible than the BA.2, which is the most dominant variant right now in the world, causing the surges in Europe and other countries in Southeast Asia. And of course, there's a looming surge in other countries as well. Whether it is more transmissible, yes, it's 10% more transmissible than
Doc Tony, pasensya na po,
BA.2.
is it 10% more or 10 times more transmissible?
10% more, according to the WHO report at saka sa UK.
Okay.
And hindi pa alam whether this would present symptoms more severe than the original Omicron, or it can cause more, I would say, it would evade ang immunity natin, ang tawag ng immune escape, or it will actually dodge or render the vaccines ineffective. So far, we don't have any reports on that. But what we know is the transmissibility is 10% more than the current BA.2, which is the most dominant variant right now in the world.
But because this was again discovered in the UK, as you mentioned a while ago, because of their very rigorous and aggressive genome sequencing, has there been any study, because this was 2 months ago, January 19, over 2 months ago, on its virulence? I know you had answered that a while ago, but just going back to any UK study on this, wala ho bang lumabas doon sa kanila na mas matindi ito, mas seryoso po ang epekto nito or not?
Well, I have a report that in mid-March, I think Dr. Anthony Fauci said it's 9.6, so it's very close pa rin to the 10% transmissibility. Ang problem lang natin, Pinky, in our country, dapat paigtingin ng Philippine Genomic Surveillance ang kanilang pag-testing dito. Kasi hindi natin alam, because of the liberality right now ng ating travel guidelines, pwede tayong magkaroon nito, considering ang Thailand is about 3 hours away from our country. So dapat lahat siguro ng samples natin, i-check natin whether we have the Omicron XE right now. Para sa ganon, maiwasan natin yung surge na nangyari nung January, February with the Omicron.
Do you think it's just a matter of time before makapasok po dito tong XE?
Well, I think maaari na mag-wane kasi yung immunity natin, PK. I think the low number of cases right now is a result of two things. The huge vaccination effort of the government, na alala mo in December, we have 15 million. And then the natural immunity brought about by the Omicron last January, February. So we have a hybrid immunity. Plus, we know that Omicron is a winter virus, nasa summer period tayo. But we know that based also on studies that the booster ay bababa ang immunity niya 3 to 6 months. And we have only 13 million or na boosters sa ating bansa. So we need really to redefine what is the complete vaccination for the country. Kasi ang akala ng marami, humina na yung pagbabakuna natin because akala nila 2 bakuna lang enough. The third shot, which is the booster, should be the complete shot so that we can actually reduce the infection related to any variant that will come along our way.
Let's go back to what you were saying earlier, Dr. Tony, so that we understand it better. For those who have had their primary shots, let's stick to that first. Yung nakapagdalawang shots, or if it's J&J, just one, the effectivity of those shots. We won't go first to the boosters, primary muna tayo. Nawawala na po ba ang efficacy after how many months?
And that's a good question. It was found out on July 29 of 2021 in the Israel study na nawawalang effect after 6 months. And that was the impetus, Pinky, for the Israeli study to get the booster
Boosters.
shots for their patients. And that was also the study used in America for the approval of the booster, yung third shot. Yun
Right.
ang ginamit po yung Israeli study po.
Okay.
So nawawala po, Pinky, 6 months po.
Opo,
6 months.
regardless of the vaccine, whether it's
Yeah,
the inactivated virus or the Pfizer Moderna.
I can only speak, Pinky, for the American vaccines kasi ito yung ginamit, mRNA vaccines na ginamit sa Israel. And so far, what we have right now on paper, whether do sa third shot at saka sa fourth shot, ang ginamit ay Pfizer at Moderna.
Okay.
So it might actually be along that way din, Pinky, in terms
Alright.
of the immunity.
So 6 months, based on studies in Israel and the United States, it wanes, hence the call for booster shots. So after 6 months, Doc Tony, tapos ka na sa primary, nag-booster ka na. Gaano katagal tong booster ngayon?
Well, based on study again, that was the trigger for the Israel study for the fourth shot. Nakita nila 3 to 6 months nag-wane yung booster. So ginamit ng Israel sa 65 years and older. So ibig sabihin, Pinky, like for example, in my case, I had 2 primary vaccines. Dalawang Astra and then have Pfizer November 28. Then I had to have a fourth shot dahil high risk ang mga healthcare workers, and then let's say senior citizen ka na with comorbid condition, then you're entitled to a fourth dose kasi based on the US FDA study, 65 years older or 50 years old and immunocompromised and then with comorbid conditions, then you're entitled to get the fourth shot.
Oh, so if we were to take you as an example, your booster, you took your booster November 28, that means sometime by May, at the latest, you should get your fourth shot?
Yes, Pinky. I would be expecting it because based on the US FDA approval. So therefore, that regulatory document should be adopted here in the Philippines para tumaas, Pinky, ang ating primary vaccination and booster shots.
Apo.
Kasi kung magiging requirement to, ang hinahabol natin, Pinky, ang malaki, 66 million ang fully vaxxed ng 2 doses. Ang booster lang natin ay 12.2 million based on the DOH data. And the DOH is calling on 46.8 Filipinos eligible for the booster. So kung gagawin nating 3 doses ang full vaccination, solve na natin, Pinky, ang 27 million vaccine expiring.
Yeah.
Kasi taklob na kagad yun, Pinky.
Let's talk about what they could possibly do, which is redefining what fully vaccinated could mean. But we need to take a very short break. This is The Source on CNN Philippines. Please stay tuned. The Source on CNN Philippines. I'm Pinky Webb. Our source today, health reform advocate Dr. Tony Leachon. So, Dr. Tony, do you agree that this fully vaccinated term, which really refers to 2 vaccines as your primary dose, or maybe 1, I think if it's J&J, is it time to redefine it and make it 3 shots? So, primary plus booster.
Yes, Pinky, I believe so. Hindi lang naman ako ang may opinion nito. Even the academic experts from Harvard and in America, and most, I think, vaccine experts, gusto nilang i-redefine to. Na dapat hindi 2 doses, kung hindi 3. Kaya lumamig, Pinky, ang pagtanggap. Akala ng maraming tao, pag naka-2 bakuna ka na, okay ka na. Kaya yung booster, bumaba kasi akala nila 2. Kaya I cannot imagine, Pinky, why the booster shots may apathy and very cold ang receptance nila. Samantalang wala ka na dapat vaccine hesitancy since nakatanggap ka na ng 2. But if they can actually mandate us to have 3 doses, then we will be protected just in case the Omicron XE will come to our shores and at the same time solve our problem on the expiring vaccines. And then later on, yung fourth dose will be actually be the booster na kailangan natin.
I see. So it's really, you agree that fully vaccinated should be the primary plus booster. And then, yung fourth, or yung second booster, yun yung dapat tawagin lang na booster. Kumbaga, yung first booster shot dapat isama na sa primary vaccines. But just also, sir, it's good to talk about that number that you referred to a while ago. There's a balance of about 46 billion for individuals to get their booster. No? So obviously, this is still the third one. Itong 27 million, madali siguro itong magamit kung magpa-booster itong 46 million individuals.
That's correct, Pinky. Napakadali niyan. Kasi kung nakatanggap ka na ng dalawa, what would stop you from not having it? Kasi siguro, dahil bumaba yung level of education akala nila pag fully vax ka, dalawa lang. Samantalang sa CDC, alam nila tatlo yan. Tsaka imposibleng magdalawang boosters kasi every year, isa lang ang kailangan mo. So, imposible naman 2 boosters a year ka. Dapat once a year lang. So, dapat i-reposition nila, i-redefine siguro ng Department of Health na 3 doses talaga ang full vaccination and a 1 booster yearly. Yan ang magiging tingin ko the future.
Right. Understand what you're saying. What about the plan? Because we're talking about the 27 million vaccines that are set to expire in July. Do you agree that some of them or some of these could actually be donated so that we don't actually really waste these? Or should government aggressively really push for the booster shots?
Well, I don't agree na mag-donate tayo kagad kasi charity begins at home Like yung ibibigay nating Sputnik, that's 92% efficacy rate We have not, dapat may win-win solution dito. And ang nakita ko lang dito is to redefine ang full vaccination. Ang dali na yan sa workplace Alam mo ba, Pinky, sa workplaces, more than 90% ang acceptance ng vaccination. And if we want to keep the economy afloat, then we have to protect our employees, the healthcare workers. Kayang-kaya, Pinky, yung 27 million vaccine doses, worth 13 billion. So sana wag natin munang ibigay sa ibang bansa. We try muna exhaust all other means. Marami pang ways, Pinky. Let's say, let's involve the medical community. Alam mo ba, Pinky, ang Pfizer and Moderna ay hindi na EUA sa Amerika, kundi full approval, which means it can be given to the drug chain, huge drug chain stores, katulad sa Amerika ng Walgreens. So, at saka mga Walmart. So, everybody, if you increase the vaccination rates, then everybody can go to these vaccination sites rather than magbabottleneck ka in mga mega vaccination areas. So, the strategy is to have more vaccination sites, more vaccinators, and then redefining, Pinky, the definition. Then you will solve this particular problem of expiring vaccine rather than give it away. Sayang naman. Kasi inutang natin yan Ang laki-laki ng inutang natin only to be given away when meron man tayong 3 months to go before the expiry date in July.
Health reform advocate, Dr. Tony Leachon. Sir, thank you so much for your time.
Thank you, Pinky, and a good day.
Thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.